Dr. Deepak Sharan is an orthopedic surgeon and rehabilitation specialist, and he runs this hospital and also a number of clinics, and they specialize in neuromusculoskeletal rehabilitation throughout India. This is 36 patients who are treated for pain with coMra therapy in their main rehab center. What we have for the children that come in there right now are cerebral palsy, club foot, spina bifida, and myofascial pain syndrome. What happened was they treated these 36 kids from 4 to 23 years old. They went from a 1 week treatment to a 4 weeks. The duration of treatment, well, it depended on the severity of the condition. I'm going to talk about how the treatments were done in the context in a second, and of course, the use of different settings with the Delta. They do a surgery there called semleras. They do cuts of the tendons and adjust bone ossifications and all these things in one session. And when the kids come out, they're in a cast. Once they take the cast off, they go into phase 1, 2, and 3. And talking to one of the physiotherapists there, because there's a long physio protocol afterwards, as soon as they take that cast off, this is when they start using the Delta, because this is when the pain starts for the children. For all cases, all 36, reduce pain, reduce swelling, reduce muscle stiffness and tightness, range of motion increased, scar adhesion and tightness decreased, and also hypersensitivity. Because pain was an indication for treatment in all the cases, they used a visual analog scale, again, which is at 0 to 10. What they saw was significant reduction in all pain scores for all patients. And from that, the conclusion in the report is coMra therapy is a useful adjunct in our rehabilitation program for pediatric patients who've undergone the surgery for cerebral palsy, as well as a few other non-surgical patients. I'm just going to go through these very quickly, just to give you an example. The main outcome, pain reduction, and you can see here the different levels. So phase 1, as soon as they came out of the cast, and then into phase 2, etc., etc. Okay? Thank you, everybody. Thank you, Arjan.